Hi, everyone. My topic this term is going to explore the vicious cycle, alcohol, mental health, and relapse prevention. Alcohol use disorder, also known as AUD, is a chronic brain condition characterized by compulsive drinking, loss of control over alcohol use, and negative emotional state when not drinking. It's closely intertwined with mental health, especially depression and suicide. The key findings I'm going to be talking about are relapse and cognitive bias modification, as well as alcohol and depression, dual diagnosis, and alcoholism and suicidal behavior, as well as relapse prevention. For relapse and cognitive bias modification, one study that offers new hope for relapse prevention is the RINC 2018. It focused on a technique called cognitive bias modification, which aims to retrain the brain's automatic response to alcohol. Uh, Specifically two major cognitive biases that contribute to relapse, which are approach bias, the unconscious pull towards alcohol-related cues, and attention bias, which causes people to overfocus on alcohol in their environment. From the article, the researchers combined both bias modification methods in abstinent alcoholics and found something promising. Um, the dual approach significantly reduced relapse rates, and most importantly, that it's non-pharmacological brain-based intervention. So that means not adding more medication, but reshaping how the brain automatically reacts to triggers. So it's a big reminder that relapse prevention can be deeply neurological, and that changing unconscious habits might be just as important as willpower or support systems. For dual diagnosis, alcoholism and depression, Um, the main point is comorbid alcoholism and depression worsen each other's course. The author stresses the importance of integrated treatment, which is addressing both conditions together, which is alcoholism and depression. And the takeaway from this was that it's equally as important. And as successful recovery requires a comprehensive plan that addresses both alcoholism and depression at the same time, and treating everything will support long-term healing and prevent relapse instead of focusing on just one condition. Alcoholism and suicidal behaviors. Um, the main takeaway from this was that routine suicide risk assessments are essential for patients with AUD. And in the Share article from 2006, they estimated that up to 40% of individuals with alcoholism will attempt suicide at some point, and roughly 7% die by suicide. Some of the key contributing factors are um, depression, aggression, impulsivity, and major life stressors, especially interpersonal disruptions like a partner breakup. And while demographic factors such as being an older male and living alone or having past suicide attempts further amplify the risk of suicide, they suggest that there should be routine suicide risk assessments that shouldn't be optional, they should be essential. Mental health screening, crisis planning, and suicide prevention strategies must be fully integrated into addiction treatment programs. Um, The key learning opportunities for relapse prevention is just everything I said, the cognitive bias modifications in Brink 2018 and the THAS 2001, which shows the depression and alcoholism um, risk for relapse, and the dual diagnosis treatment that is critical for long-term relapse prevention, as well as the Share 2006 um, suicidal ideation, which um, helps relapse prevention to be successful. The recap for this is that alcoholism, depression, and suicide risk form a dangerous cycle that demands more than one-dimensional treatment, and that effective care must be holistic, treating not just addiction, but the whole person. In the research from all the articles, it shows that depression and suicide frequently co-occur with alcohol use disorder, complicating recovery and increasing the risk of relapse. Which is why clinicians must routinely screen for both depression and suicide um, in alcohol-dependent patients. And basically, evidence-based strategies like cognitive bias modifications um, offer new hope by retraining the brain's automatic response to alcohol cues. These tools enhance long-term sobriety when paired with traditional care. And then ultimately, successful recovery depends on integrating pharmacological treatments, psychosocial support, and cognitive retraining. Breaking the cycle starts by addressing the full scope of each individual's needs, not just their substance abuse or use. And we can all help someone struggling with alcoholism just by being there for them and supporting them through their journey. Um, thank you for listening to my presentation.